provision of healthcare. How is the government exposing itself if, say, today one decides to go sue the government for failing to provide these services?
Thank you, Dennis, and this is a very legitimate question. We have, as a country now, the Social Health Authority. We have the Social Health Insurance Fund. We have several medical schemes. In fact, as we're talking today, we have a number of Kenyans who've been detained in hospitals for more than 1 year. I assisted somebody to be released the other day after more than 1 year detention because he's been treated, but he doesn't have money to facilitate his release. A private hospital wanted to be paid more than 2 million shillings. This is a person who lost touch with his home completely. When you read Article 43, the right to attainable standard of health and the requirement that the government should ensure that this is done progressively. Progressive thinkers, progressive constitutional lawyers and judges have said that this is a right that has crystallized. This is a right that the government must now deliver. Why? We have a budget as a country of about 4.7 trillion shillings. We no longer have a shortage of resources in this country. And therefore, if you go to a hospital and you are not able to get the necessary treatment in a public hospital, you can sue the government because the issue of resources is no longer limiting. You have a budget of 4.7 trillion shillings. Our budget is bigger than that of Tanzania. It's bigger than that of Uganda. We're doing very well economically as a country. So the issue of resources is not an excuse anymore. So that the issue of progressive realization of the highest attainable standard of health is no longer a question to be determined. That is already determined because of the budget that we have. The problem that we have, and this would come out as we continue with this discussion, is that when we devolved health, we expected that the right to attainable standard of health would move very quickly to villages and hamlets. But unfortunately, we've not been able to get the right governors. We've not been able to get the right county executive committees who would be able to implement Article 43 of the Constitution, implement the same with military precision. Money, we have it. What we do not have is the right people to manage health sector, the right people to manage medics. We do not have the right people to engage medics at that level so that they're able to serve Kenyans and ensure that as a country we are able to get the proper diagnosis so that as a country we proceed on the right prognosis. So many people in this country, Dennis and Do, go to hospitals, even level 4 hospitals, level 5 hospitals, and they are misdiagnosed. The biggest problem in our health sector today, this is 2026, is not even lack of treatment. Misdiagnosis. You're told that you're suffering from malaria, and then a few months later it turns out it was something else. You've been treated for malaria. Or you're diagnosed with tuberculosis and you're treated for tuberculosis, and then a few months later on another diagnosis is done, and that has to be reversed. The negative side effects of being administered with tuberculosis drugs when you had no tuberculosis. It's a very sad situation. Or some people have been diagnosed with cancer in this country when they didn't have cancer in the first instance, and then they decide to rush to India. When they go to India, they are told there is nothing like cancer. There are no cancerous cells in their systems. They have not been treated. They